Hey everybody, it's Dr. Brian McKay, Core Health and Darien, and I want to talk to you about back pain. Many different ways of treating back pain. I'm sure you've got a whole bunch of your own if you have back pain, but probably one of the most effective ways of dealing with back pain, I feel personally, is spinal decompression. And spinal decompression is a very effective way of dealing with lower back pain. Uh, because the disc itself, if you have a herniated disc or bulging disc, I mean, a lot of times you'll need an MRI to confirm that. But this can you suspect it? Any good doctor can suspect whether or not you have that type of a back issue coming from a bulging or herniated disc. And the way I personally like to treat it is honestly is that first you address the pain, then you address the disc, because if you have structural misalignment, say the pelvis is out of whack or the lumbar vertebra twisted, putting that pressure on top of that disc, you need to remove that interference. It just makes sense that if you're really going to do a solid job on it. But you can get an idea about how bad back pain can be. It really disrupts your life, especially if you like to play golf and you can't play golf, or you like to go running and you can't go running, or tennis, or once a back issue, or once any issue starts to interfere with your normal quality of life, you really have to think about doing something about it. But I have a personal story. I had a bad back. It was over 20 some odd years ago, probably at this point 22, 23 years ago. And one day, the spinal decompression company comes knocking on my door, offers me a machine. I think at that point it was $150,000, and the payment was more than my mortgage at the time. And I politely told the guy no, and I was going to go home and have lunch on my break. He would not take his foot out of the door, and he said to me, he goes, "How about I leave it here with you for 3 months, and you put your worst cases on it?" At that point, having have a back issue with that at that point, I was pretty agreeable. I said, "Okay, what do I have to lose?" So, North American Spine sends up the machines, trains everybody on it. I get on it, and I do get better. And at that point, I had tried a lot of things myself. I tried cortisone injections, obviously chiropractic, physical therapy, massage therapy, medication. Nothing with exercises. Nothing was really working. And then, having done spinal decompression treatments myself, I did see all of a sudden now exercise and stretching, everything else became more effective. So it was a way for me to cycle out of a back issue on my own, and I really learned to appreciate spinal decompression. But it also taught me how to do probably a better job, I feel, in treating back pain with using spinal decompression. You can't put someone who's in pain on it. It's counterintuitive. I mean, yes, a lot of times people put me on a machine, put me on a machine. It's not a good idea to put people right on the machine. It's just not. You need to let the pain subside, and you need to kind of create a more welcoming structure that will allow for the less compression on the disc. Again, if your pelvis is twisted out of alignment, or the lumbar vertebra is leaning on that disc, um, remove that interference and make it a little bit easier um, make it easier for the person to, you know, for the underlying condition to heal. If you take the pressure off the disc, the herniation still could be there for sure, but then you can address actually the bulge or the herniation. Now, the one thing you got to think about is how. Well, I guess you probably want to know how it works. Motion is basically imbibation. There is real no blood supply to the discs, so you have to. It gets its nutrition through imbibation, so you have to move things around, and that's typically how it's done. So people move stuff around, and the fluid disperses and lubricates when you have pressure that prevents it. A good way of looking at it is if you have a sponge that's on the side of your sink, you go away for a few days, and it's not as cushiony and it's not absorbing as it is when it fills up with water. Well, your disc is like a sponge. It has supposed to have a cushioning effect, and when it loses that cushioning effect, it becomes brittle and hard, and then it doesn't have the same spacing capabilities that a healthy disc has. So things become lax, and the ligaments become lax, and you also have pain associated with it. So when you pop that disc back up, it comes back to life, and that's what spinal decompression does. Is it gets the fluid to come back into the disc space and rehydrate the disc through the motion we call imbibation. So it's some people consider spinal decompression like gently stretching the spine, and it does that, but it does it with the angulation is really important to get the fluid back into, or kind of get the genie back in the bottle. I have another good way for you to think about how it works. When you squeeze a tube of toothpaste, you would have a little bit left on the end. As soon as you take the pressure off the tube, it goes back into the tube. It's very much similar to what happens with the when you take the pressure of the spinal discs. It's like a gel-like cushion. It's made out of cartilage, and what we do is we get the genie back in the bottle. And docs, you can use it for neck pain as well, but I really wanted to, focus today on lower back pain. So people with sciatica, weakness, tingling down the leg, posterior facet joints, arthritis, irritated nerve roots. So all these different type of, conditions really can make a difference. A lot of times people are going to try non-steroidals. Non-steroidals is an external thing that really is not going to, it can take the pain away short term. And listen, you need it, you take it. I'm not opposed to it, but, if you're constantly popping Advil and Aleve, maybe it's not the thing for you. But people will continue to take Advil and Aleve for years thinking, hey, I'm out of pain for, at least during the day, or, but in a sense, they're not really doing themselves any major services. Listen, physical therapy is wonderful. We use it all the time. You got to get people moving. And once we go through, basically my protocol would be is using chiropractic adjustments to get you out of pain initially. Once you're stable, we continue to do the chiropractic adjustment along with the spinal decompression, and then as well as exercise. I mean, massage plays a little bit of a role, but that's more the accessory muscles like your iliotibial band, your hamstring, your glutes, quads. Those muscles do respond, kind of pick up the slack when you have instability in the joints, in the spinal joints. So I have no problem with using different physical therapy modalities. I mean, when a muscle is really dysfunctional, we'll use cupping on the muscle. Stretching, but it's really important that the person understand they've got to do home exercises. It really is. It's just a necessity. If you're not going to do exercise and you sit down as much as we do, typically it's just not a healthy environment. And now it's you got to work with me. I mean, it's one thing. I can get you out of pain, but the question is, do you want to stay out of pain? And it really becomes a team approach. So, the decompression is a wonderful, wonderful treatment. I've used it myself. I love it. Patients love it for obvious reasons. It works. I think sometimes people do not want to, practitioners don't want to make the investment, but the investment really is in best ways we can possibly help our patients. Now, of course, there's people who really do not, I wouldn't put you on a machine. So you have a fracture, you ruled out immediately. Tumors ruled out immediately. If you have an abdominal aneurysm, which is the aorta, which supplies blood supply to the lower extremity, you can have a bubble in that, and we're not going to put you on it because the bubble could break. And if you have too much osteoporosis, it's also not a good thing. And there's metal implants in the spine. Another reason we probably wouldn't want to take you on as a patient. Let's face it, we want to be successful. We want to be safe, we want to be comfortable, and we want to be effective. Treatments here at Core Health in Darien, but not we have our precautions to take. Now some people do go for spinal decompression surgery. I think it's a bit much because you really can never undo surgery, and there are risks. As with anything, there's risks, but I think you'd be better served if you tried non-surgical spinal decompression first and then migrated over to, you know, if that doesn't work, then I think I don't have a problem with referring people out to surgeons, because the matter doesn't always get resolved with what a chiropractic office does, even though, for most time, we're doing a pretty good job of helping people, but not the fact of the matter is not everybody's going to get better from what we do here at Core Health. So we try to take a realistic view on this and a pretty comprehensive approach. I'm Dr. Brian McKay of Core Health in Darien. You have a question, you can always reach out to us, 203-656-3636, 203-656-3636. Stay healthy, and we'll be through this corona pandemic, hopefully sooner rather than later. Thank you very much.